So let's talk about hair loss. So if you are a patient suffering with hair loss, the first and most important step is to be evaluated so that you can determine exactly what type of hair loss that you have. The physicians who are board certified and trained to evaluate and treat all types of hair disorders are dermatologists. When I see patients with hair loss in my clinic, we initially evaluate the scalp, take a history of all the details of the hair loss, and often do blood work and sometimes even a biopsy of the scalp to determine exactly the type of hair loss that you have. This is so important because hair loss treatments are not one size fits all, and you really have to target the exact mechanism of the hair loss to get your best result. This patient had androgenic alopecia, which is a genetic, hormonally driven type of hair loss in the scalp. There are a number of different treatments for this, including topicals, injections, and oral medications, and most patients realistically need a combination of these therapies to get their best result. In this case, we did 3 injections spaced 1 month apart of a customized medication directed at the hormonal hair loss, as well as topical therapy, and she's thrilled with her result. So injectable therapy for hair loss is really popular among patients. First of all, because it's highly effective, but also because it does reduce the risk of systemic side effects. So it's a very common option for patients to choose. There's a number of different things that you can inject into the scalp, and depending on the type of hair loss disorder that you have, it can be customized to be the most effective. So for some conditions, you will inject steroids into the scalp. For others, you may inject PRP or platelet-rich plasma. And in the case of this patient, we injected a medication called dutasteride, which can be taken off-label orally for this type of hair disorder, but she was concerned about side effects and preferred to go the injectable route. And I think that she had just as much benefit with this treatment injected as she would have orally.